Thank you very much for inviting us today to this Best of ASCO. So after the presentation about GICC, I will present about the best of publication from the African Pediatric Oncology teams during the 2020. My name is Laila Hessissen. I am pediatric hematologist and oncologist in Rabat, Morocco, and also ASCO Africa president. So in Africa, there is very few journals dedicated to publishing oncology research, and most of them are publishing adult research. And in general, the number of papers published in pediatric oncology are less than 1%. I would like to report about this very interesting publication about essential medicine in Ghana. It's entitled Health System Determinant of Access to Essential Medicines for Children with Cancer in Ghana. So the effective care of children with cancer needs equitable access to quality chemotherapeutic and supportive care medicine. In Ghana, limited access to essential medicine compromises treatment. And the objective of this study was to generate policy-relevant evidence on the state of and challenges related to access to essential childhood cancer drugs in Ghana. The study mapped and analyzed the determinants of access to childhood cancer drugs using a mixed method of analysis, the availability and cost of essential childhood cancer drugs, and the health system and socio-political determinants of drug access for children with cancer. The drug stock and prices were retrospectively collected. So the results was that Ghana lists only 45 of the essential drugs in childhood cancer, revealing gaps in domestic formulary inclusion, and the stockout occurred for 88% of essential childhood cancer drug. And the drugs procured inefficiently were more susceptible to stockout. The principal determinant of drug access included lack of socio-political priority afforded to childhood cancer and the impact of policy and the regulatory environment on drug affordability, availability, and quality. So the conclusion of this study was that the study provides context-specific evidence to enable responsive policy development for efficient drug procurement and supply management in Ghana. So the second publication is an interesting work from the Wilms Tumor Africa group, and it's entitled Working Together to Build a Better Future for Children with Cancer in Africa. The collaborative Wilms Tumor Africa project was formed in 2014 and have been implementing a consensus adapted treatment guideline in 8 centers in sub-Saharan Africa as a multicentric clinical trial. The participant centers are from Malawi, Kenya, Ghana, Cameroon, and Zimbabwe. And during the first 5 years of the trials, 201 patients was included, and the study showed that there was a statistically significant improvement of survival without evidence of disease from 42% to 69%, and an important decrease of abandonment of treatment, and fewer patients died during treatment. The collaborative Wilms tumor project phase 2 is planned to start during the year 2020. There are minor revisions in the guideline and treatment, but what has been included is mainly supportive care for children, since it is an important component for survival and to reduce early death from cancer. So the SUCUR group was created. It's the supportive care for children with cancer in Africa, and this group is building on the regional network of the collaborative Wilms Tumor Africa projects and the lesson learned, and SUCUR aims to promote improvement in supportive care for every child in Africa to be able to be cured from cancer. The third publication is from the French African Group of Pediatric Oncology, GVOP, and it reports about the treatment of Hodgkin lymphoma in sub-Saharan Africa. So this is about treating Hodgkin lymphoma with chemotherapy alone. They report the results of therapy in Hodgkin lymphoma in low and middle income countries are not as good due to several factors. One of the key reasons is that radiation therapy centers in sub-Saharan Africa are rare. This is a prospective collaborative multicentric study. The participants center are Burkina Faso, Cameroon, Mali, Madagascar, and Senegal. The patients were divided in two groups. The first group is the favorable outcome group, and the second is the unfavorable outcome group, and the chemotherapy used was COP-ABVD cycles. So the results is that 160 patients were included. Median age was 10 years. There were a predominance of male, and the largest numbers of patients were having advanced stage and unfavorable presentation. Most of the cases were of nodular sclerosis subtype. But even without radiation therapy, this protocol allowed the group to achieve a good event-free survival. So those are the three publications from Africa, but in general there is few papers published in Pediatric Oncology from Africa, and we need to encourage the African teams to publish more about their experience, and this can be done through organizing workshop for publication and training the pediatric oncology teams in Africa to publication process. Thank you very much.